A brain aneurysm is an outpouching, a weak spot, or a bubble on the artery in the brain. It tends to occur where arteries divide, and there's an inherent weakness which can increase over time to the point where it gets so weak that it ruptures or breaks, causing an intracranial hemorrhage.
Risk factors for an aneurysm are very similar to cardiovascular disease. So it would be smoking, high blood pressure, certain medications. It affects women more than men, and it also affects African American more than Caucasian.
Brain aneurysms are a very serious event. When they rupture, up to 40% of patients will lose their life. We try as hard as we can to identify them early and treat them as rapidly as possible.
There are 30,000 ruptures every year. 15% of people die. They don't even make it to the hospital. The problem is there is still a large number of patients who are misdiagnosed.
Headaches are very common, and most patients who rupture a brain aneurysm will complain of very severe headaches. Because headaches are common, many physicians and providers will confuse a symptom of a headache and not consider brain aneurysm in the diagnosis.
Patients will go to an emergency room with a severe headache, neck pain, and oftentimes sent home because they feel it's maybe the flu, maybe anxiety, maybe stress. And this is a big problem because then they will go home and oftentimes never make it back. They will die.
If we miss that opportunity to get that patient quickly to the hospital because we make an incorrect diagnosis or we assume that it's a more benign syndrome such as a migraine headache rather than looking at it as a potential brain aneurysm, we can really worsen those patients' outcomes.
We're almost like detectives in the field, and we have to look around and be aware of our scene and look for medications and walk in and have that 30,000-foot view, because if we don't have that, we will miss things.
Early detection is the key to trying to achieve good outcomes from treatment. The better condition that a patient is in when this diagnosis is made, the better chance they have of doing well. When aneurysms rupture, they can cause coma, they can cause serious deficits, and we can get patients through those problems, but it's much more difficult to obtain or achieve a good outcome. So early detection is, in fact, the cornerstone of preventing that kind of problem.